Welcome to a very, very special episode of the NYU GPH podcast. Today, we have the privilege of speaking with a leading research methodologist and also the dean of NYU School of Global Public Health. We have Dr./Dean Melody Goodman. Dean Goodman has been a part of the GPH faculty since 2017 and has been the interim dean at NYU GPH since March of 2024. With over 150 peer-reviewed articles and 2 books, her contributions span prevention, treatment, intervention, and even policy. She's a fellow of the New York Academy of Medicine and the Statistical Association and has received numerous awards. We didn't have time to put all of them in the intro, but you can look it up and there's plenty of awards. Dean Goodman, congratulations. You're now the Dean of NYU Global Public Health, and welcome to the podcast.
Thank you, and I'm glad to be on the NYU GPH podcast today.
So this is your first semester as Dean, official Dean in fall 2025 when we're filming this right now. How's the start of the semester been for you?
The start of the semester has been busy but fun. You have all of the orientation events and all of the sort of new semester events, which is busy, but it's also been great to welcome a new cohort of students to our school and to just see how excited they are to enter the field of public health.
Has there been like a surprising moment or any change since interim dean of semesters and current dean? Has there been a change in the energy for you inside?
I think the surprising thing for me, especially as a statistician who is introverted, as many statisticians are how many students want to talk to me. Usually students avoid their biostatistics professors. So this is sort of a new phenomenon for me because, I always had students who, would say hi in the halls and stuff, but typically students aren't running after their biostatistics professors for additional conversation after class or in the halls and the like. And so it's been interesting to meet many more students and for them to want to speak to me and really come and engage me. So I think that's been the real difference. I feel like I was like, oh, were they running away from me before? But it's been nice that, so many students want to engage with us. Alumni, too. We just had a great alumni event on Thursday. And it's been great to meet alumni, especially students who were graduating when I was just starting here. Students who took like some of my first courses here, the first courses that I taught here at NYU. And so it's just been great to see them and have them engage and want to speak to me. And so many congratulations on the new role, particularly from students who took my biostat courses many years ago.
Yeah, they must be like, oh my God, I took Dr. Goodman's class, Dean Goodman's class now.
Yeah.
So we're really interested in talking to people that are passionate in growing this entire enterprise, and they have different goals and they come from different areas, but they're serving the same concept of public health. And we're so lucky to be talking to you because you're one of the superstars. And I have to know, what is your superhero story, the origin story? What was your public health journey? How did it even start?
My public health journey started when I was a financial analyst on Wall Street, doing investment banking work. When I was an undergrad, I thought I wanted to be rich when I grew up. I think a lot of students feel that. And then I think working in the bank gave me a different perspective on what rich was. When I was an undergrad, I thought rich is like how much money you make. And for most people, that is what it means to be rich. But it became clear to me that that wasn't going to be a satisfying career. It didn't seem important enough or fulfilling enough as a long-term, when you're starting off in your 20s, this is the thing you're going to do for the next few decades. It didn't seem meaningful enough in some ways. And so for me, what it meant to be rich sort of changed in terms of, yes, I would like to have enough money to pay for groceries and, live a very comfortable life. But to me, rich sort of changed into what is the impact that I'm having on the world and how am I using my skills to give back? And is anyone going to be better for the work that I do? And while I think rich people enjoy being richer, there wasn't lots of life-changing things that I was doing for them in that role. And I looked for how could one use math and health, and that's how I found biostatistics, something that no one ever knew about. I didn't know about it as an undergrad. And I was like, well, this seems like a cool way to use the skills that I'm using now to actually help people and make real impactful change in the world. And so it really changed my definition of what rich meant. I still think you need enough money to survive. This is New York City. That takes a fairly decent salary to do that. But for me, rich also means that you're doing something that fulfills you personally, that you're passionate about, and that you're having some meaningful impact in the world.
It seems like the money was the goal in the beginning and the idea of investment banking took you there. How did the love for biostatistics or public health develop from that area? It seems like there's a passion that, oh no, serving others. There was a theme that kicked in at the time. Was it?
So yeah, I think for me, it was really trying to understand communities. When you grow up in a low income neighborhood and you quote unquote get out, you try to figure out, how do I get everyone out, or how do I make this a healthier community? And so understanding that public health gave me the tools to do that. For me personally, I was working with lots of data in my investment banking job, and being able to see that those skills were transferable, that I could use those data analysis skills to answer different questions that were health related and community based and sort of more important to people's lived experience and everyday lives. That was the thing. I really enjoy problem solving. And so I think the moment I knew I fell in love with public health was I was working on a problem and I had this large data set that had almost 4 million observations and probably over 300 variables. And as a naive first semester, I don't even know if I was in my first semester, it might have even been the summer before I started my graduate work, I was like, so I should be able to answer all the questions with this data. It has so many observations, it has so many variables. And the question that I was trying to answer, I just couldn't get from this data set, right? And I knew I was in love with public health when my answer was, we need better data, right? I wasn't frustrated. I didn't feel like there was no solution to the problem. I was like, well, different people need to collect the data and they need to be asking different, the fact that it made me want to dig deeper, that's how I knew I was super excited about the field and the space.
So I'm someone that knows very little about biostatistics, and I don't even understand the gravity of 4 million variables in data. Can you simplify that for me, of what that might even look like for someone?
So we were actually looking at infant mortality data. So we had every person born in the United States in a given year, and that year was probably 3.8 million. It was close to 4 million. We had all the information from their birth certificates, and then they actually link it to death certificates for infants who die within the first year of life. So then you also have all the information from the death certificates. It made me, one, realize that lots of data are collected for other reasons. We don't collect birth certificates so that I can analyze that data. That's not even why it's collected. The same thing about death certificates. That's not why it's done. But we end up using those data sources in different ways. And so if you think about it, I was wrong too, but I just thought, this is so much data. I have the whole population. I have all of these variables. How could I not be able to answer some of the questions that I thought at the time were really basic? They're really challenging questions, but as a naive student, I thought I'll be able to figure out why Black women have double the infant mortality than white women. I have this data set. I have all these variables. One of them or some combination of them should explain this difference, but it didn't. And having all that information, and this is, I don't want to say myself, but this is 20 plus years ago. So a data set that size was hard to work with back then. It took a long time for the computer to do things, and you had to be really careful. I took down a server, I think, at one point, just trying to analyze some data. So you don't want to do that. But it made me realize that we were using lots of other data sources to try to answer what I think are really important questions. And these data sources weren't designed at all to answer these questions. So it makes sense that I couldn't get the answer that I wanted. But I think for me, Usually, if I can't solve a problem, I get frustrated and I don't want to do that thing anymore.
Oh, wow.
Right? That's usually like, oh, I can't solve it. This is impossible. I want to move on to something else. But the fact that I kept being like, but why can't I solve it? I have all this like it made me ask more questions. I was like, oh, this is the thing for me. Like, this is the thing that keeps me, because I was like, there's no way that I can't answer these questions with all this data. I mean, I think just as a statistician, you think like the more data I have, the more information I'll be able to have. And for me, I knew that I was in the right field when I could not solve a problem. And then all I could think about were other approaches and different ways and different data sources to try to get at it versus like, I can't solve this. Let me move on to the next thing.
Yeah, that was the first indication of this is who I was. I'm getting frustrated that I can't solve a problem and I let it go. And this one you could not let go.
Yeah.
You're like, I need to know more.
Yeah.
To me, what I got out of this is that the gravity and the amount of data you would have, you would think you'd get the answer
Yes.
from 4 million.
Yes, exactly.
Yeah. If I have 4 million of these water bottles in this room, we wouldn't have space to walk. And still you can't get the answer. That's where it's interesting to see the side of like, I need the answer that the numbers cannot identify. And it seems like that's where you moved into that area.
Yeah. And it made me think more about like, where are we getting our, like I went upstream, right? Like, where's the data coming from? Well, why are we collecting this data? Oh, not to answer this, like then you just start to ask different questions. And for me, I knew like, as a math person, every problem you get, you want to solve. Like that is the goal of any math class you take. They give you problems, you solve them, right? And so usually when I can't solve a problem, I'm like, oh, this is frustrating. Like, I get frustrated and I don't want to do it. But this was a problem that I couldn't solve. And I wanted to, and I still wanted to, even after working on it for a really, really long time. And I think that's how you know you're passionate about something, when like, usually you would throw your hands up in frustration. The fact that you're still like digging in, then that's your thing that you're really passionate about.
Yeah, it almost seems like we keep hearing at GPH or in the numerous interviews I've done of qualitative and quantitative. And one would think biostats is just quantitative stuff. And now you were thinking more beyond the numbers and where the numbers coming from, what's the filtration system of this, and that's very eye-opening for me to hear as well. You were mentioning about growing up in a different environment. I'd love to hear about where you've come from, where you grew up, and what was that journey like?
So I was born and raised in South Jamaica, Queens, New York. So I'm a New York native. Although when you grow up in an outer borough, which Queens is considered an outer borough of, Manhattan, which is considered the city, you get a really different perspective. I think growing up in Queens was amazing. The last time I looked at the data, Queens was the most diverse county in the continental U.S. I think there are 2 other counties that are more diverse than Queens, and they're both in Hawaii.
Oh, how unexpected.
Right? But, sort of in the continental U.S. And so even if you grow up low income in a place like that, I realized later that it felt like I had been all around the world, right? Because I knew what good Thai food was. I knew what good Indian food, like I knew, like, because homemade is always the best, right? So if your friend's parents are making you homemade whatever, and then you go to some store, you're like, oh, that's not,
that's not the real thing.
And people are like, where's this girl who grew up in, I grew up in NYCHA, New York City Housing Authority. I grew up in NYCHA housing, right? And so most people who grow up in that kind of low income housing don't have a grasp of international foods and the arts. And I think my parents did a really good job of exposing me to the arts early. There's lots of free things to do in New York City. And I think we took advantage of all the things that New York City has to offer. But I think the thing that I appreciate most is the cultural diversity. And being in friends' homes who are really culturally different than me. Some homes you take your shoes off. It really depends on the culture. And I think learning that as an elementary school kid really changes the way you view people and you view the world. And as someone who likes food, I think my introduction to most cultures was through their cuisine, and found that passion really early on. And so I even tell students now, I say, when you have a stressful day at GPH, my advice is that you take the train to Queens. And while you're on the train, you decide what type of food you want, or what part of the world you would most like to go to, and then go to that community in Queens and have that experience and have a great meal, and it'll make the day much better.
Watch in midterm seasons, the entire 7 or 8 Broadway ends up in Queens at a restaurant because of Dean Goodman's
But I do think
recommendation.
a good meal can change the day. And particularly if you're homesick, a meal that feels like home can really change how the day feels.
Absolutely. Absolutely. A good thing to note for everyone, whether you're a student or not. This is a good meal, especially in Queens, can change the whole dynamic of the day. Let's talk about your time at GPH. So you've been here since 2017 and your roles have evolved over time. So you start in 2017, then you have become interim dean in March of 2024. And now how are you viewing that how do you think that's taken you to this area?
Definitely wasn't on my bingo card. So it wasn't like I planned to be in this role. My journey to NYU is actually a little bit different in that my previous 2 roles had both been in a medical school, and this was my first time being in a school of public health. It was my first time being on the livelier campus. Usually the medical school is really older folks and doesn't have a lot of undergrads, right? So it was nice to be on the livelier campus where things are happening. And it was my first time being in a biostatistics department. So I've always worked in public health. Usually I've worked in spaces where I was the only biostatistician. So like a public health group with a bunch of interdisciplinary people. And I was even on a listserv called ISOStat, which was for isolated statisticians.
Oh.
That's like how isolated I was. So when I got here, I think the nicest thing for me was to be around other statisticians and be in an apartment with other statisticians. I think my first administrative role was interim chair of the biostatistics department. And one of the things I did was start our MS in biostatistics degree program, which is one of the fastest growing degree programs here at the school. I think for me, GPH has been a great learning experience, but I also think as someone in a leadership role, having been in a faculty role before makes me really think about leadership in a different way, because I remember being the faculty and saying, well, why are they telling us to do this? Or who made that crazy decision? Or why do they think that'll work? And why did no one ask me my opinion? Not that it mattered that much at that point, but I think it makes me lead a little bit differently. I think I talked to you a little bit earlier of, our school's going to go through a curriculum review, and I'd been out of the classroom for many years. And so I felt it was important for me to get back into the classroom and, do some hands-on things. And so I think as a leader, to have a real understanding of what it's like to be on the ground of whatever your field is, I think it changes the way you lead. And so I try to be more collaborative in our decision making. I try to be more transparent when I make decisions about what data I use and what information I use to make that decision. Not that I think that everyone's going to agree with the decisions that I make, but I do think people are less likely to say, well, why did she make that decision? When they know, this is why I made that decision, right? And you can agree or not agree with that. And so I think having been in the faculty role, having really worked with students in my lab, I think it gives me a different perspective. Even though I'm sort of at the top of this, whatever this mountain is, I really understand what it's like to be in other positions around the school. And I think about that a lot when I'm trying to make decisions.
First off, that's so beautiful to even hear. There's something that really struck me as you were giving that answer about, years ago when why are they doing this? Why is faculty being impacted? I have this opinion, and you said not that my opinion matters. And over the few years we have seen it really does, and it's coming from somewhere. And I can only imagine thousands of students or even members of public health around the world that feel the same way. Oh, I have this opinion, but my opinion doesn't matter. I feel like it's developed for you over time. How would you respond to those people?
So I think I would tell those people now that, one, your opinion does matter. I was just giving you my perspective as a junior or early career faculty member. I do think the people who are doing the work should speak up about policies or whatever. The people that are being impacted should have a voice in the decisions that are being made. And I hope that the people at GPH feel like when things are not working, they can come to me and have a really thoughtful conversation. I think what I like most about working in an academic environment is that you work around all of these intelligent, brilliant, thoughtful people. And it doesn't make sense for me to not use that, right? Like, yeah, I have good ideas, but other people also will have good ideas. And we probably would come up with better ideas if we put our two good ideas together. So I hope I'm creating an environment where people don't feel like my opinion doesn't matter, even though I felt like that as a early career faculty, where they understand that their opinion matters, but also their experience is really what I'm interested in. How, like when we make a policy, what is the lived experience of that policy? How does it really
Wow.
impact the people that we put that on?
Yeah, getting into the lived experience is so crucial, which is it's like the math argument versus data and what's actually happening thing that you were saying. So as someone that's been here for a few years, that student success and their career is a big core value for us at GPH. And for someone that's early in their career, I'm sure they're also looking for mentors. And you must have had a ton of mentors in your journey to this point. So what have your mentors or your journey taught you to this point that you're taking forward with you as dean?
I've had a lot of mentors. And one of the things that I will tell people is that you need you need a village of mentors, right? Like there's no one person that can give you all of the type of mentorship that you're going to need. I think the best piece of advice, well, there's probably two things that I got that really helped me, especially as an early career person. One was that everything is temporary. So in the good, like don't get too high on yourself, but also enjoy the up. Like when good things happen, you should celebrate and like really reward yourself because it's temporary. But also when you're in the bad moments, to know that that's temporary and that there's another side. Because I think sometimes when things are bad, you kind of sit in it and you don't think about, I will get through this and there's something on the other side. And so that was a piece of advice. So whenever something great happens around here, I try to celebrate because you just never know, especially these days. You don't get that many good things, so we need to celebrate the good. But also when we're in a bad time, I just try to remind myself that it's temporary and we will get through this. I think the other piece of advice, particularly folks that are in the academic space, that helped me, and I don't know if it'll help others, but it did help me, was one of my mentors telling me this is the rejection business.
Wow.
So I think, if you're submitting abstracts or papers, there's a lot of like acceptance or and in the beginning you can take rejection really personally. And people say, don't take it personally. I'm like, it's my work. It is personal. I spent all this time on it, right? But when he told me it was the rejection business, and I'll follow up with the piece that he gave me, is he basically told me that it was my job to be rejected. And I was like, oh, I could do that. That's a job I'm capable of doing. And I think it changed the way I thought about the things I was approaching. And then he followed it to say that, the people who have a lot of successes have also had a lot of rejections. You just tend to see the successes, right? No one goes on YouTube and says, I got rejected from this thing today. They go on YouTube and say, I got accepted to this thing, right? And so I think, knowing that the more rejections that I would get, the more successes that would come after it. But I also think it changed the goal line. If your goal line is success, that becomes really hard. If your goal line is to get the thing submitted, that's a different and easier goal, right? And so when he told me my job is to get rejected, I was like, oh, that's a job I can do. I know how to get rejected. I'll just submit more things. But what happened is, yes, I probably got more rejections, but I also got a lot more acceptances because I was submitting more things. I wasn't being as fearful about the things I was submitting because I was like, what's the worst case? I'll get rejected. That's my job, right? And so I think it just made approaching anything that had an accept or reject feel different because the goalposts change. And then you end up getting a lot more acceptances and you realize that like you just have to change the way you're approaching things and not be so scared. I think the other thing that people always say is you have to be in it to win it. That's like a line that people say, but I don't think people really realize what that means. It's like you have to throw your hat in the ring. You have to submit the abstract. You have to submit the paper. You're never going to get accepted if you don't do that part. And I don't think a lot of people understand that usually the rejection comes from us holding ourselves back versus someone actually telling us no. And so for me, getting rid of that. I think the other thing that helped me a lot was, it's actually the same mentor. He pulled out some data to show me that when men get rejected, it was about publication. So when men got a paper rejected, they would resubmit right away. And when women got a paper rejected, they'd wait about 6 months before they even work on it. Right. And so just the way I think we handle rejection, gendered wise, was different. And so for me, I was like, oh, so the goal is to get rejected and get it back in. Right. And so what I always tell my students is rejection is a status. And if you don't want to stay in the rejection status, you have to resubmit it somewhere else, right? And so they say, did you have that paper rejected? Nope, it's submitted at XYZ journal,
Wow.
right?
Wow.
So it just really changed the way that I did things, right? Because I was like, I'm not going to leave the reject there that long. It's resubmitted somewhere else. And it just changed the way I think about the work. And I think it also changed my success, just thinking about rejection differently.
Yeah, how long are you willing to stay in this state? You can change your status immediately. Just resubmit.
That's the goal. So now when I submit a paper, I already have 3 journals in mind. So when it gets rejected, because the thing is, like, when you get rejection, it's an emotional response, right? And you're like, they didn't like me, that, you extrapolate all these things. And what I've learned now is I could still be frustrated, but if I know where I'm sending it next, then I can just angrily submit to the next place. But then I've changed the status of it. It's no longer rejection. It's resubmitted somewhere else. And so that's been my philosophy of, like, you can reject me temporarily, but I get to change the status of that rejection, and it's up to me to do that.
Yeah, it's almost like I'm updating my software every time I resubmit. Wow, what a unique take on that. I mean, I've heard it. You hear that same advice in so many ways, and this is a very unique reframe to help so many people approach this, because it's part of the public health journey.
Part of the public health journey is to get rejected. And I think if you just change your outlook on rejection, it makes it much different. Yeah.
Rejection is a feature, not a bug.
Yes.
Almost that way.
Yeah.
I want to talk a little bit about the future. And you mentioned in your message to the entire school that public health is at a critical juncture. And I want to know, how, as a leader and practitioner, are you thinking about this moment in public health?
Yeah, I think there's a lot of things happening, right? AI, right, is going to change the way we all work. And so I think it's just a challenging moment in general. I think public health has always had a branding issue in terms of the things we do well, we don't get credit for. And then when things don't work, we totally get the blame, right? And so when I'm talking to people, I always talk to them about seat belts and traffic lights. I'm like, that's the best public health intervention, but we never talk about it that way. We probably call it a transportation intervention, but we never call it a public health intervention. But it saves many lives, right? And it is a major public health intervention. And then I say, do you enjoy those cruises you go on? Do you know that someone has to inspect them? There's food safety. There's all of these public health professionals that make it so that that cruise is as enjoyable for you as it is. But you don't think about those people when you're enjoying your cruise. You only think about them when there's a disaster. I don't know if you've seen the Netflix special, but there's been some disasters on cruises. And you only think about public health when it's negative. You never think about it when it's working. So I do think we have a little bit of a rebrand problem and an image problem. But I think part of the solution to that is the work that we do. I do a lot of work that is community and partner engaged, trying to work with other sectors. And I feel like if people have good experiences, particularly working with schools of public health, then that'll change the messaging that then comes out. And so I do think we're up against many challenges. One is people outside of our field branding what we do in ways that I don't think we would brand ourselves. I think the technology has changed. So I talked to you about having this big data set that was 4 million observations and 300 variables. I almost shut down our server working with it. But now we can work with that data set and things will be done in 10, 15 seconds, right? Where I was waiting 3 hours sometimes to get an estimate or run a regression, right? And so our computing power has changed so much. It means what we can do changes so much. And then I think the other thing I'm really excited about is, when I was growing up, oil was the world's best commodity. And these days it's data, right? It's one of the world's best resources. And I think for public health, a field that often is under-resourced, the fact that we are having so many new data sources. I'm wearing one. I don't know if you wear one, right? But many of us wear
I am wearing one.
a watch that tracks our steps and many other things. It's basically a data collection tool, right?
Yeah.
And so our ability to analyze things, even people's cell phones that we were using during the pandemic to monitor people's patterns, I think the ability to do things is going to really change. And so I do think it's an exciting time. I think the challenge of the role that our government, the US government, will play in public health is unknown at this point, or how it will be. But I also think, when I graduate, I always tell students now, if I was graduating now, my first job would go be a startup. Like you could become a billionaire and then you could do whatever you want, right? But that really wasn't an option for me 20 something years ago when I graduated. But it's like everywhere now, there's health startups. So I just think our students will have to think differently about what a career in public health means for them, and how they will achieve that. But I think we're up for the challenge, right? And I think New York City is a great place to explore those things. We have so many like major institutions here, great community organizations. It's a great place to figure out if the job you want exists or if you have to make it yourself, right? And so I do think we have to think about, how do we train our students for an evolving workforce that may be different than the one that was available to us when we were sort of going out looking for jobs? But also think there's some excitement in that, in terms of things that we weren't doing well. Maybe this provides an opportunity for some genius to rethink, how we were addressing certain problems and do it differently.
How can this organization, NYU GPH, shape the future of public health? How do you see that happening?
So I feel like our best investment is making it in our students, right? So you guys are going to go off and do great things. The students will go off and do great things when they leave GPH. And so for me, it's how do I help them do the things they want to do? Are we giving them the tools, the resources, the skills, and the network, essentially, to do the type of work they want to do? And are we preparing them for a job that doesn't exist now, right? Like, are we thinking ahead enough to prepare them to be the leaders in fields that may not currently exist or don't exist the way they are now? And so one of the reasons why I decided to take on the role permanently is this idea of impacts. And I was a little nervous in the beginning because I was like, you could get to a point where you're so far removed from things that you may not have the impact on the ground or in the field that you want to have. But for me, I was like, this is a chance to really rethink our curriculum, think about how we're serving our students. And I will say that when I went to grad school, that was the place that I fell in love with public health. And so I want to make the School of Global Public Health here at NYU the place that our students come and they fall in love with public health.
We're at a really cool point. We're at our 10-year anniversary over here at NYU GPH. And what message do you want to convey to the students at this juncture of the 10-year anniversary, who will soon become the future public health leaders?
So I think this is an exciting time for NYU School of Global Public Health. We're building on a foundation of probably close to a century of public health teaching and scholarship here at New York University. So it's new, but it's also old, right? It's building on something that has been around for a while. I think the 10th anniversary is exciting. I don't think I realized when I came in how early I was in GPH, because they already felt like a community, but the school started in 2015 and I joined in 2017, right? And so I think I was one of the first external hires into this new school. And as I mentioned, I was one of the first hires into our biostatistics department. To see what our school has done in 10 years is almost somewhat daunting. I've been thinking about this because everyone's like, well, what are you going to do in the next 10 years? And I'm like, I don't know that anyone could have predicted this in the first 10 years. So I don't want to dream too small, right? I don't think that anyone dreamt this for the first 10 years of a school. And I feel like my dreams would be too small because what this group of people have been able to accomplish in 10 years is amazing. But I think it's an exciting time to be in a place that is structured enough, but isn't traditional. We don't really have we're young. We don't really have traditions. When someone says, well, we always do that for the last 3 years, 4 years, how long have we done it, right? It's not that long. And so I think it's a nice opportunity to shape a place, to really help build whatever our traditions will become. And I think for us, it's really going to be focused on our students and giving them an excellent student experience. I want people to talk about their time here, even after they're gone, in a very passionate way. I want them to have that kind of experience where they feel like it was a change point in their life. And I do think, I was born and raised in New York City, but I do think the saying, if you can make it in New York, you can make it anywhere. Like we say, if you can make it here, you can make it anywhere. There is something to say about that. And I do think for however long our students, particularly the ones that are residential, come and live in New York City, I think that can be transformational. And I hope that they think about this as a time in their lives that really transformed them into being what they wanted to be.
Before we close, I have to ask you about a very special individual. I've been hearing about someone that's your partner in crime, your life coach, the person you go to for everything. Apparently, this person is even your security detail. Can you introduce us to Kong?
This is Kong, GPH security guard, GPH ambassador. Be careful, he may lick you to death. He loves other people and really loves coming into the building. As you can tell, he's very comfortable in this space here at 708 Broadway, and I think he really enjoys all the folks here on the 8th floor that give him lots of attention, and some of them actually give him some treats. He always comes in and looks for Rob down at the security desk because Rob keeps treats down there. And so he knows all of the doormen and all of the security guards who give treats. But I also think it's a great mental health intervention when you have a rough day. Just having him around. He's never had a bad day. He's never woken up on the wrong side of the bed. He's happy every day, as you can tell. And so he's a great reminder that there are positive things, even on your worst days. He always reminds me that the joy of just life, because he's always just happy to be around.
What class does he teach at GPH?
He could definitely teach you best restaurants in New York City, especially the ones that are dog friendly, because he knows where he's going to be welcome around the village, I will say.
For all dog friendly students or people that do have a pet over here, which restaurants would Kong recommend to them?
Any restaurant that has a dog bowl outside, he knows automatically that they're going to be dog friendly. So there's a bunch of places that keep little water bowls outside. And so that is your signal if they have a water bowl outside. And he knows as soon as he sees that it's a place that he'll like to be.
Dean Goodman, thank you so much for your wisdom, your good spirits, and it's got me even more excited for what's coming here at NYU GPH for us.
Thank you for having me on the podcast. I really enjoyed it.
So if you see Dean Goodman on campus, say hello, share what your experience has been like, and join us for a bunch of amazing activities here at the 10th anniversary of the school. There's a lot going on here. Keep an eye out for that. Attend the events and say hi. You're going to be taking the school forward. And thank you, Dean Goodman, for being a part of our journey and everyone else's journey at the school.
Thank you for having me.
Absolutely. We'll see you in the next episode, everybody. Take care.